To hear what Mayor
We
Hancock
know
has
that
to
this has
say.
been a very difficult time in the life of everyone in the city, throughout the state, and around the nation. And jobs have been lost, businesses have been shuttered. Loved ones are seem like they live in different states, even if they live just a few minutes away. We haven't been able to see them, to commune as family, as friends. Our daily routines have been severely disrupted. And so we know this has not been easy, but this is what will help us get to the other side of this curve sooner and get us opening our economy back open in very safe and healthier ways. Everyone is complying with the public health order, is doing a fantastic job. And so again, we say thank you. In this room today, we have the National Guard, and we want to welcome them as well. Thank you for being here and being our partners. This is serious, but there is also hope, and we can and do control our destiny. Yesterday, we issued an extension until April 30th, our stay-at-home public health order. Given the current data and advice from experts about the spread of COVID-19 in our community and across the nation, this is the right thing to do. We know it is a few days longer than what the governor announced yesterday for the whole state, but for the same reasons we moved sooner with the stay-at-home order here in Denver as the urban center where there is more population density, we are going to need to take a broader approach. And so we are prayerful and hopeful that we are able to end our stay-at-home order sooner. But the goal is for everyone to return back to our normal routines as best we can, safer and healthier. Now, we know these measures have also been especially difficult on our residents who are experiencing homelessness, and difficult on the providers who have been working overtime to continue to support them. Since this crisis first reached our city, we have been working with our primary service providers to increase support for our residents experiencing homelessness. In coordination with Councilwoman Robin Kanish and others who have surveyed what other cities have done, I have been on the phone with mayors all over this country to make sure we are learning from each other. Every day, our team down here in the Emergency Operations Center is in contact with the Homeless Leadership Council, updating them on what steps we've taken and receiving updates from them on the gaps that still need to be filled in their facilities. I want to thank that Leadership Council for their partnership during this time. It has taken collective effort from all of us to serve these residents and to ensure that we can protect their health and well-being. Some of them are here in the room. Thank you for your partnership. The coordination has been especially important because, as we all know, the situation changes every day, actually almost every hour. And it has required our team working on a variety of strategies to be ready on any given moment to change course and to tackle new options. Today, we're announcing that Governor Polis has approved our request to deploy 250 National Guard members to our existing shelter facilities to support the staff and trained professionals at these locations, to support their guests in the best way possible during this crisis. Again, thank you to Governor Polis, and thank you to the men and women in the National Guard. Now, let me describe a few of the actions we've taken early on, and then get to actions that have taken longer to accomplish, but are now more realizable thanks to the National Guard being present. Number one, we opened a recreation center as a day shelter for up to 200 women, opened a 48-bed facility for people who are symptomatic, and made 120 motel rooms available, and identified many more as needed for respite care and additional rooms for families. 97 of those rooms that were identified for respite care were occupied last night. We've redeployed city staff to assist at these facilities. The city is also partnering with the Colorado Coalition for the Homeless to add hundreds of activated respite rooms into the pipeline. And we are in conversations with hundreds of hotel rooms for high-risk individuals, including seeking partnership with the state to potentially expand our capacity to more than 3,000 rooms. As you all have reported, yesterday I sent a letter requesting more rooms for our healthcare workers and for people experiencing homelessness. This only comes on the heels after numerous conversations with hotel operators and the fact that we were not able to move the needle fast enough. And so one comprehensive letter was designed to activate the conversation or raise it to another level in terms of the level of urgency that we have here in the city of Denver and the needs for these rooms as we experience our peak. I am extremely pleased that to have learned last night that we have finalized a contract for 151 additional hotel rooms, and we will be submitting to the Denver City Council approval as soon as possible. And I was able to share with Council President Jolyn Clark this morning that we'll be direct filing this contract request to City Council hopefully next week. These efforts represent an unprecedented level of cooperation among the providers and the city. It will also allow us to provide a safer and healthier level of care and to pull limited staff, volunteers, and resources. In the coming days, we will be opening an auxiliary shelter to provide 24/7 services and physical distancing needs for individuals experiencing homelessness. This auxiliary shelter will have the capacity for up to 600 men and individuals identifying as men and be established at the National Western Complex Hall of Education. I want to thank Paul Andrews, who is here with us. Thank you, Paul, who is the CEO of the National Western Stock Show Association, who didn't hesitate to step up when we first approached. He is working with us to make this happen during this time of need for many of our most vulnerable residents. To everyone associated with the National Western Stock Show, thank you for your partnership and your generosity. Our goal here is to begin to relieve some of the pressure of our current shelter system, allowing them to provide greater physical distancing between guests. I want to say this again because of all the media questions I've received why this is important. There has not been an objective greater than our efforts to get on the other side of this curve over the last 6 weeks. We cannot expect that we can be successful in doing that if we are not properly serving, sheltering, and providing proper physical distancing with our residents who are homeless. They are as much a part of who we are as a city, and a need to make sure that they're protected and healthy and safe is equally as important as it is for the rest of us. And so I am honored that so many partners have come to the table and said, what can we do to help? Including many of those individuals and corporations who have asked if they can donate dollars to this effort that we've undertaken. So thank you very much for your support, and know that we won't stop until we believe we have adequate support to take care of those individuals who are experiencing homelessness in our city. Our goal here, again, is to relieve the pressure in our current shelter system. Just like we are having a plan for decompressing our hospital system, our shelter needs are similar in this planning. Getting the right support services like food, showers, and security have been a part of this work, and I know Britta Fisher, our Executive Director of Host, and her team have been steady on this effort. The accommodations and services at this shelter will include 3 meals and snacks a day, restrooms and showers, wireless internet, laundry services, storage, and parking and public transportation access. Screenings for COVID-19 and referral to supplemental shelter and activated respite rooms if needed, where guests with symptoms being transported to supplemental shelter and guests who are medically advised to isolate to be transferred to activated respite rooms. Plans being made for further assessment in health care, including mental health and behavioral health care. So it's important to recognize that we are continuing to, even in these efforts of setting up these alternate services, to keep our residents who are experiencing homelessness connected with the other services necessary for them to be healthy while they are being housed and sheltered. We also hope to have the details finalized soon for a similar shelter for women going forward. Now I want to say this, the people of the city are working in so many ways to support their neighbors. It makes me proud of the city and the community that we are to hear of the many stories that we are hearing in terms of people stepping up and doing extraordinary things to take care of their neighbors. Stories like the DHS, Denver Human Service employee who took it upon herself to personally deliver and make sure that paperwork was signed so a family could receive their SNAP benefits. As I was coming down the elevator, I was listening to the story of another Denver Human Service employee who has volunteered in one of our homeless shelters and serves as a shelter manager, has donated over 130 hours of her time, giving back and making sure that we are doing right by our residents and neighbors who are experiencing homelessness. We know there are myriad of stories, hundreds of stories all over this city of people who are stepping up, knocking on doors, making sure that they're able to stand in the gap for their neighbors, picking up groceries, taking folks to pick up their pharmacy prescriptions. Everything that we are doing, we are coming together at this time that we are being ordered to stay apart so that we can be together very soon. And I'm trustful and optimistic that we'll be able to do that sooner than later because of the extraordinary efforts of every one of us in this great city. To everyone who is volunteering, continuing to support our small businesses and restaurants, thank you. The organizations like the National Western Stock Show and the service providers who are going above and beyond the call of duty to help in any way they can. To everyone who is staying at home, from the bottom of my heart, we say thank you, because these are the only mechanisms that are going to help us to get on the other side of this and begin to repair our city and our lives, at least as we remember them as best we can. We're going to get to the other side of this. I believe it in my heart, and we're going to be a stronger community because of it. Now, I want to bring up our Chief Housing Officer, Britta Fisher, to provide more details on our efforts to help residents experiencing homelessness. Britta?
Thank you, Mayor Hancock, for your leadership and your commitment to bringing every resource to bear and for the city to be a collaborative partner in all of this. Now more than ever, a community response is key to assisting persons experiencing homelessness. It takes more than just the city. It requires a response that is coordinated with our shelters, our service providers, the business community, and our government partners. I'm honored to work day in and day out with such a strong group and talented group of providers here to be in that last line of defense, that social safety net for persons experiencing homelessness. And we're fortunate to have such a strong group of service organizations in place. In responding to COVID-19, our top focus is persons experiencing for persons experiencing homelessness has been to support our network of shelter and other service providers through daily collaboration, helping to source much needed equipment and supplies, and establishing strategies to remove symptomatic guests from our existing shelters. That is, connecting guests to supplemental shelter and to respite rooms for rest and recovery. Today represents a huge step forward for promoting greater physical distancing for persons experiencing homelessness. The Homeless Leadership Council came forward with a strong need for additional distancing of guests, as well as more staffing, and we responded, working in partnership together. We evaluated several sites, including many of the large sites around Denver, including our athletic stadiums and other things. We're grateful to all the partners who allowed us in to evaluate those sites. We selected, ultimately, the National Western Complex, and a full-fledged effort is underway to covering many of those components that Mayor Hancock just mentioned, including food service, housekeeping, security, portable showering facilities, transportation, and many other elements, including primary and behavioral health care. Since the Department of Housing Stability was formed 5 months ago, we have spoken to our vision of a healthy, housed, and connected Denver. While the strong links and data between health and housing have always been clear, this health crisis has made that abundantly evident. We continue to lead with a housing-first approach to get people into housing and work with our providers on how we can get more people into housing, even in this crisis. We continue the work of helping to house persons experiencing homelessness in hotel and motel rooms and are prioritizing that effort. We're grateful to the support of the state of Colorado in aggressively pursuing hotel and motel rooms for both protective action and for respite. As I close, I just want to say thank you and echo the mayor's thanks for this community response. There is no shortage of bumps and challenges. There are things to work out in any crisis. But thanks to our partners with providers, the state, the National Guard, and many others, we're clearly moving forward in the right direction. And it is of great relief that we will have some additional boots on the ground tomorrow in our existing shelters as our providers nod vigorously. So I, at this time, want to bring up one of those providers, Brad Miley, the Executive Director of the Denver Rescue Mission.
Thank you so much. This has been, over the last few weeks, a very, very difficult thing for us to be working with people that are experiencing homelessness. While the rest of the world has been socially distancing, we really have not been able to do that. And so it is incredibly exciting, and I think a wonderful partnership between city and the nonprofit community that we are able to provide this at the National Western. And again, I want to thank the National Western for being willing to do that. One of the critical things, I think, is the fact that we will have, through the Colorado Coalition for the Homeless, South Street Medical Clinic, the ability to triage folks and to be able to figure out if they need some other kinds of help. And so, Mayor, and I just want to say thank you so much. It's been wonderful to be able to move to this next step, be able to socially distance, and be able to reach out to people in our community, frankly, who are just the most vulnerable.
Thanks, Brad. So we're going to go ahead, I believe, and open it up for question and answer if we have some on the line.
I have a question.
Again, oftentimes the forgotten people in any large city, the homeless, certainly the topic, as Mayor Hancock, along with Britta Fisher and Brad Miley, talking about Denver's plan for trying to help them through this pandemic as well. Of course, the stay-at-home order in Denver now 4 days longer than the stay-at-home order in the state. Governor Polis issuing that order yesterday, or extending that order, but Mayor Hancock referring to population density as a reason to extend that 4 days further in Denver. Governor Polis has approved 250 National Guard members to help in shelters, supporting staff as well as the guests there. And the National Western Complex offering up to be used as an auxiliary shelter with some 600 beds. There certainly is a lot to cover. We're going to recap all of it for you coming up in just a few minutes on 9 News at noon.
Strategy.
Hi, I have a question. This is Connor from Westward. This is Connor from Westward. So, Mayor, are you disappointed that the governor didn't fully answer the call for National Guard for help in setting up the auxiliary shelter?
You know what? The reality is the governor had to make his determination on his, based on his own, or the statewide objectives with regards to National Guard. They're going to be pulled in a lot of different directions, and we recognize that. And we heard the governor, and so we are going to Plan B in terms of how we're going to staff and secure the auxiliary shelter.
This is Lori Lizarraga with 9 News. Mayor Hancock, will the convention center and this new shelter at National Western Complex and in the hotels be staffed with doctors and nurses? And if so, will they be pulled from hospitals here in the Denver metro area?
So you should know that the convention center will have doctors from all over the metro region, I believe, who that will be staffing and caring for the patients that are going to be there. What was the other question, the other part of your question? National Western.
National Western Complex, the hotels that are getting involved in the motels also be staffed with nurses and doctors there?
Yeah, thanks for that question. At the National Western, the Stout Street Health Center, which is the Colorado Coalition for the Homeless's health program, will be staffing that with primary care, behavioral health care, and will help with the screening at that location. They continue to provide additional health care resources in our respite rooms as well for that medical monitoring for people who are recovering from COVID and COVID symptoms. And we're very grateful to have their partnership, as well as Denver Health and others who we remain very coordinated with, as well as our public health guidance from Bob McDonald and the City of Denver. Thanks.
This is Ray Solomon with KUNC. I was wondering how you're planning to ensure social distancing at the auxiliary shelter.
Bretta?
We are very fortunate to have the experienced staff of the Denver Rescue Mission who is able to utilize the 100,000 square feet there that will provide ample room on the main floor of the complex that we are utilizing. And so there will be some guidance and house rules, so to speak, to encourage that, and will be reinforced by the staff of the shelter itself.
Any other
Lori
questions?
Lizaraga.
Mayor, this is Conrad Swanson with the Denver Post. I was hoping you could elaborate just a little bit on some of the difficulties that the city has had trying to partner with hotels, specifically the Hyatt and the Westin. I understand that they've been particularly difficult to partner with for individual restaurant rooms.
Well, I don't know where that came from. I didn't say it, so I won't accentuate that statement with regards to the Hyatt and the Westin. You know, they we own the ground that the Hyatt sits on, but they have exclusive rights to operate the hotel. And it's owned by the authority that is set up. With regards to the Westin, there are some legal challenges with regards to the Westin. Though the airport owns and operate, you cannot. The Westin has exclusive operating rights, and you cannot divert those resources away from FAA purposes. So, you know, those are some of the hurdles that, as we have talked about and work with different hotels, or different challenges in each one of them. And our goal is to try to get over each one of those hurdles to hopefully create opportunities. But this is something that we're seeing all over the country, by the way. As I've talked to mayors all over the country, all of us have been met with challenges in trying to provide housing for the homeless within the hotels. And a lot of them come with different legal liability insurance type challenges as we have approached them. Any other questions?
Yes.
Can you talk more about the build out of the convention center and the necessity for that? I mean, some of the models that we've been talking about show, you know, we might have hit the peak or are about to hit the peak. Are you seeing different numbers indicating that this is going to be necessary in the coming days and weeks?
So I'm going to bring up Matt Mueller to talk about the build out of the convention center for our surge care facility. Matt is the executive director of our emergency management center, and then Bob McDonald, our executive director of public health and environment, can talk more about the modeling coming forward. So I'll bring both of them up. Matt.
Thank you.
Thank you, Mayor. So in regards to the convention center, that is a partnership with the state of Colorado. We are working very closely with them, as well as our regional healthcare partners throughout the metro area, to stand up what we call an alternate care site to decompress our existing hospital system. And so the state of Colorado is working with the U.S. Army Corps of Engineers. We're in close coordination with them. They anticipate that should be opened here within a couple of weeks. In terms of the question of regards to where we're seeing the peak, I'll turn it over to my colleague, Bob McDonald.
So thank you for the question. It's a very good question, and it's really hard to say, to be honest with you. Modeling is not perfect. It's dependent on many different variables. When communities implemented their social distancing efforts, how rigorous their testing was at the time they did that, how embedded the spread was within their community by the time they implemented those activities. What I can tell you is that over the last 3 or 4 days, we've seen some very encouraging data. It has leveled off, and I think this next week is going to tell us a lot. If it continues to level off, that will tell us a great deal. And I think a lot of that is attributed to the mayor's efforts to be very bold and to act early on implementing our social distancing efforts. So we'll know a lot more in a few days.
Other questions?
Hi, this is Mo Clark with the Colorado Sun. This is a question for you, Mayor Hancock. Curious if you will be issuing a formal suspension of the camping ban during this time for people experiencing homelessness.
No. Our focus is really working to shelter those who are experiencing homelessness in our city safely. and in decent facilities that are well staffed and connected with resources and services. Last question. Thank you all very much. Thank you. Thank you guys very much. Thank you very much.
150 National Guard members are going to be deployed to existing homeless shelters to support staff as well as the guests.